Greetings. This is Rip Hollister from Colorado Springs, here to introduce to you the Technology-Supported Health Confidence Project for Colorado. This program will provide your practice with a great web-based patient survey tool which will allow you to painlessly receive meaningful patient reports through a free patient portal. It also automatically builds your practice a useful registry which can be used for important programs like the Medicare Annual Wellness Visit, Meaningful Use, and payer quality metrics, programs which can bring real dollars to your practice. Okay, you ask, how much will this cost me? Well, it's free through a grant provided by the Physicians Foundation and administered through Colorado Academy of Family Physicians. Not only is it free, but you can qualify for a $600 practice improvement grant, and you're automatically enrolled to compete for a $1,000 grand prize. Well, are you interested? If so, it'll be worth listening to this brief 8 to 9 minute introduction. First, let's take a look at the project's goals. This project has 3 basic objectives. The first is the introduction of the health confidence concept. This is a simple query for assessing a patient's global sense of medical wellness and their ability to effect positive changes in their chronic disease processes. A patient's health confidence index has been shown to relate directly to significant health risk as well as health care costs. Objective 2 will be to register your practice for How's Your Health. This is a family of tools that has been proven to enable patient engagement as well as to help you develop interventional action plans for patient problems. It also provides excellent registry functionality for your practice. Objective 3 is the introduction of a brand new innovation, the Physician Practice Ally. The ally is a patient who you will select from your practice to help you and your practice use the project's resources to develop new efficiencies in patient care. This changes a patient into a real practice asset. Health confidence. This is a new, simplified way of making a global assessment about a patient's medical well-being. It simply involves answering this question: how confident are you that you can manage and control most of your health problems? The answer will be not very confident, somewhat confident, or very confident. It is measured on a scale of 0 to 10. The next objective is to register your practice for How's Your Health. This is a web-based technology that provides an online health checkup for what matters and what might be the matter for patients. It is a tailored survey to assess true patient needs. It provides patients with a personal health record and an immediate action plan, together with online information and tools to build health confidence. It automatically gives physician practices a patient portal and creates a registry based on your patient's reports. These reports and the registry can be used to provide comparative performance data and numerous ways to reduce waste and save time for your practice. The benefits your practice will receive through technology-supported health confidence are considerable. You'll get a registry which is automatically and immediately built through patient-reported measurements. This registry automatically will help your practice meet patient assessment requirements for reimbursement through programs like the Medicare Annual Wellness Visit. You can use it to obtain and report patient experience measures for proving care quality to payers. It provides patients with motivational interviewing, shared decision-making, and problem-solving, and end-of-life care plans for meaningful use. You can use your registry for population health improvement and to help you meet maintenance of certification requirements. The new innovation in this project is the Physician Practice Ally. This is a person who will likely be chosen from your practice as a long-time patient. They will be a trusted partner and somebody who you feel that you and your practice can work with. They'll need to have communication abilities and be internet capable. They'll generally have a considerable motivation to serve and frequently be people like retired educators or administrators. Medical students or college students who potentially have a future in medicine or just an interest in medicine may also be excellent candidates. Your ally will be trained and supported by the project staff. It's important to understand that your practice will not need resources to train them. Your ally will need to make a 12 to 14-hour commitment of time during the project. They'll learn the technology at their own pace. They'll participate in webinars and conference calls. And once they learn the technology, they will train and help your practice develop these significant innovations. This places a patient voice at the front of your efforts to improve your practice. Let me introduce you to my two practice allies, Sandy and Carol. They are innovators and pioneers in a brand new concept and endeavor. I'd like to salute them and give them my thanks for their irresistible energy and creative input in helping us all make this project successful. Okay, now to another fun part of this project, the additional practice incentives. Now, in addition to free technology and the great practice ally training and support, all the tools we're offering to everyone who signs up for How's Your Health, there are practice incentives that will be available to qualifying practices who make it to the finish line. For the first 50 practices that register and select their practice allies, $200 in grant funds will be available. The first 25 practices who are able to enroll 60 patients in their registry and demonstrate some proficiency will get another $400 in grant funds. Now, the great competition will be for the grand prize of $1,000 as well as $500 for each of 2 run-rep practices who enroll the most patients in their How's Your Health registry at the close of this project. Good luck to you all. Time to summarize. You've got nothing to lose and lots to gain. I hope I have your interest. This project will provide free technology and training for your practice ally. It provides new methods of patient engagement, an effortless free patient registry with usable and actionable reports. This registry is created by your patient's efforts. It doesn't require your valuable time and resources. You can qualify for $600 in grant money for your practice. You can compete for the grand prize of $1,000. Hey, what's to lose? Why don't you join in? Just go down to howsyourhealth.org. Down in the bottom you'll see a place to order and register. Follow that link and go around the website and get your practice registered. Don't be afraid to go into this website. Nothing's going to break. Nothing's going to happen. We're not going to ask you for a credit card number. Just explore and see all the tools that are available for your practice. So let's get going on this. Time's wasting. Well, folks, I know how busy it is out there. Primary care is tough these days. It seems to me that the very physician-patient relationship itself is under attack. We need new innovations and new ways to improve efficiencies in our practice. Technology-supported health confidence will help us maintain strength and integrity. And as a matter of fact, it is the subject of this month's key article in Family Practice Management. The American Academy of Family Physicians considers it so important that we were able to convince them to put it outside their firewall where everyone can view it. Just go to www.aafp.org/fpm/healthconfidence. Tremendous resources are available in this article that was written by Dr. Wasson. I hope you'll take a look at it. And even more, I hope you'll be able to participate in this important project running here in our state. Best wishes to you in your practice and your success.